I'm Dr. Nasser. I'm the medical director of the Acute Rehabilitation Unit at Palmdale Regional Medical Center. Today we're going to talk with some colleagues about what is acute rehabilitation and what we have here. So we have an acute rehabilitation department. We have some very specialized equipment here, and we work as a team. What does that mean, working as a team? It means we involve physical and occupational therapy. We have specialized rehabilitative nursing. We involve dietitians and often other physician consultations. Acute rehabilitation is very special in the sense that patients who come to acute rehabilitation have active medical problems that need supervision, but also require multiple therapies like physical therapy or occupational therapy or speech therapy, and oftentimes all of those therapies in combined. We see a lot of patients after they've had trauma or sometimes after joint replacements, brain injuries, spinal cord injuries, strokes, fractures, but we're not limited to those. We see many patients who just have a host of multiple medical problems that have become very weak, can't care for themselves, can't get around the community or around their homes. And it's a very special unit because we're unique. There isn't a unit like this in the Antelope Valley other than what we have. No one has the equipment that we have. We've really gone to great lengths to get some very specialized equipment for these problems, for these disorders, and to help these people.
We as the rehab physicians have an opportunity to evaluate patients prior to coming to our rehab unit. We utilize the help from the rehabilitation team, also including a liaison, typically either a clinical or a liaison who will be an extension of our unit out beyond the unit. Patients obviously have to also have the capacity to work pretty intensely on a rehab unit. So things like ankle fracture or mid-shaft femur fractures. Anything that essentially has a functional setback for a patient, especially an inpatient unit where the expectations are a little bit more aggressive. However, programs are tailored to each individual patient, which is another fantastic part about acute rehab. It's very specialized. It's not a cookie cutter type of approach to rehabilitation by any means. And so some folks may require shorter sessions, but more spread out throughout the day. And those are things that we're always taking into consideration when patients are on our rehabilitation unit.
There are different levels of rehabilitation. So there's acute rehabilitation and subacute rehabilitation, and the primary difference between the two is the intensity of the therapy. So in acute rehabilitation, patients receive about 3 hours of therapy per day, about 5 to 7 days per week. In subacute rehabilitation, patients receive about 30 minutes of therapy 3 to 5 times per week. So the patients that come to acute rehabilitation are patients who can tolerate multidisciplinary therapy. They're strong enough, they're able to participate in those therapies, and we've also seen prior to them coming that they've demonstrated a benefit of some sort from that therapy. Contrast that to subacute rehabilitation. There are a lot of therapies that are done right at the bedside while the patient's in bed, especially speech therapy or some of the occupational therapy, where they're really working on self-care or grooming or activities in the bathroom like showering and hygiene, etc.
We strategize what's going on with the patient and make it patient-centered. How can we get this patient home safely, back to their environment, back to doing the things they were normally doing? And if we have to adjust things, we do it. The physician will say a patient's blood pressure might be hindering his ability to perform therapy. So we stabilize the blood pressure, and we notice the differences that makes. Something so small makes a big difference. So we get the patient what they're going to need to be successful at home. We like to link them to community resources. From here, we love to get patients out to our outpatient clinic for that ongoing rehab that they're going to need, because it doesn't stop here. Our rehab is so short but so crucial in order to get the patient home.